Okay, but what about that second breath? Where did that come from? What's giving that oxygen?
To the trees.
Get this. It's these little tiny things called diatoms that are phytoplankton that live inside the ocean that have these massive blooms and these massive die-offs, but they're providing for half of the oxygen that we breathe. Currently, I am trying to make an artificial seawater that is costing me an arm and a leg. I just got off the phone with a chemical company that's going to charge me $99 for vitamin B. Dude, it's all the seniors of 2021. It's their fault. But by God, I'm going to make this artificial seawater. And Lee has been helping me, and she said we'll have enough to last us like 100 years. Yay! I should be able to sell some, right? But if you're taking apes next year, we're going to grow some of the diatoms, and we're going to do a lot of experiments with them. They're pretty amazing. We'll talk more about that later. Okay, now I want you to do one other experiment for me. Okay, I want you to breathe through your nostrils, just your nostrils. Close your mouth. Couple breaths. If you need to focus, close your eyes. Okay, now in your notes app on your phone or on a piece of paper, I'm serious about this. I want you to write something down. Okay, notes app of your phone or however you do these things. I like the notes app. Okay, here you go. You ready for this? I'm going to ask you to write down one word, and that word is either right or left. Okay, which nostril were you predominantly breathing through? If you've forgotten by now, that's okay. Just breathe again. For me, it's the left. When I started this morning, it was right. Third period, it was left. Fourth period, it's right. Now it's back to left. Okay, I would love it if next period at some point, if you could ask your friends and neighbors in whatever class you have, okay, don't forget to breathe. Okay, see if it switches, because a lot of people don't realize this, but your nostrils shift back and forth multiple times throughout the day. Now, what if it's both? You're like, but I kind of feel like both. I feel like it's both. Then put both. That's fine. Yeah, you can do that. Some of you, it's like completely open up on both of them. And every once in a while, like there'll be moments where I'm like sitting around, I'm like reading a book or something. I'll take a breath. I'll be like, oh my God, it's both. And like, I should do something, right? Like buy a lotto ticket or like just breathe, you know, like there's these moments where you have this like clarity and you're like, man, is this guy on acid? Like, but yeah, the answer is yes. Yeah.
Okay, this is like a really weird question.
Yeah.
I don't know.
Okay.
How do you get burgers only out of one nut? Like, and I have like crusties in one nostril. But
Yeah.
how does that
Yeah, I mean, it's kind of like the same kind of deal. You got mucus in both.
Yeah,
Okay,
that's what I thought.
and so maybe it's drier on that side, and so those little boogers form those little hard pieces. You ever pull out a booger that's like so far up that it feels like you're pulling out your brains?
Yeah.
Ooh, I like those. Yeah. True.
So I don't know if this has to do with like what
Okay.
you can breathe out of them.
Okay.
But when I went to my first asthma appointment,
Mm.
they showed my mom how like my left nostril is like half the size of my right.
Oh yeah.
And
Yeah.
then like after a few months of being on anti-medicine and stuff, they're both like twice the size of how they were.
Oh, nice. Yeah. So that's a whole other factor there too. Yeah. Right. That's a whole other deal.
I have
But
a
yeah.
nostril.
Like, yeah, so it could be different. Also, people have injured themselves. They've deviated their septum. And when you have a deviated septum, that means that cartilage that's in between gets pushed to one side. There's a lot of factors here, but normally it switches back. And I'm interested now in what happens with you. What are you at? Are you left or right? Or are you both right?
Right now, both.
Okay, great.
So like, is that why when you get sick or whatever and your nose is like plugged and it like switches sides, does that have anything to do with it? Like how one side feels like more plugged?
Sure, could. Yeah, absolutely. All right. So here's a bunch of terms, and I'm not gonna make you memorize all these, but if you cut Carl's face off here, there's Carl. Okay, we can look inside there, these concha. If you had the skull, you know that these bony ridges here were like you looked in your nose, you're like, what is that stuff? They help channel the air to the back of your pharynx. They're coated with tissue that's lubricated thanks to those stratified cuboidal cells, okay, and those stratified squamous cells that are helping keep that all nice and moist, okay, but that's what the inside of your nose looks like. It's pretty cool. You know that it filters, it keeps stuff out, it also warms the air, which is good, and it's where all your olfactory receptors are. Those are your nerves that smell. Okay, we know the pharynx, we've already talked about this a million times, right? Here's the nasopharynx, so I can, snort that noodle and bring it out my nose because it's connected to the oropharynx. And the laryngopharynx is right there behind the larynx. Here's what it looks like in an MRI. Okay, but let's talk about this guy, the voice box. Your larynx, okay, is your Adam's apple. Girls, you have one. Now, I'm really excited about this, but I don't know if it's going to happen. I have a student who is in one of my other classes, and she said she is a friend that was born a girl, but is going through hormone treatment, kind of like with your whole thing here. And within a month of testosterone treatment, their voice has dropped quite a bit. Now, I remember when I was 15, the summer between my freshman and sophomore year, my voice went from sounding like a little kid to sounding like my dad. And I could play pranks on people that call our house and I would pretend to be my father. Okay, guys, some of you in this room may have experienced something similar as well. Your larynx is where your voice box is, okay, your vocal folds. And the reason why it deepens is that testosterone causes that cartilage to grow. Okay, and as that cartilage grows, okay, it opens that up and lowers the voice. There's the hyoid bone, there's the epiglottis. The trachea is attached. That's the cartilaginous rings. If you were not in my second period class last semester, I cut into those cartilaginous rings on that beef trachea, if you remember. Unfortunately, somehow the first period missed that. Okay, but what about like what's inside? What's like making your sound? Okay, if you're a speech pathologist, someday you'll get to do this. This is called a laryngoscope. And what a laryngoscope does is it allows the doctor to see inside your larynx and look at your vocal folds. And we can learn a lot about your life based on your vocal folds. So let's take a look at this. It's, by the way, kind of weird. Some people were like, I don't like this at all. But here you go. This is what it looks like. So these are the vocal folds. Air is pushing through that. That's the only thing that's making sound. You're pushing air through that. There's the epiglottis. The tongue would be here. The esophagus would be behind the vocal folds. Okay, and there's a frenulum. That's right. There's your trachea. What's that? So this is inside the voice box. So it's as if this is a vagina. It is not a vagina. Okay. So everyone that's told me that they've done this before said it's really uncomfortable. Okay. They spray your mouth with to numb it, and then after they numb it, then they stick this camera in there. Not a lot of fun, right? Okay. So that's what a normal one looks like. You want it to be white. You want it to be lubricated. Notice how it's moving nicely. Here's a smoker. You ready for the smoker? I got two smokers. This first one's a good one. Okay, that one is it's okay. So that was vocal paralysis. And then get this. Here's what it looks like. Here's what it looks like when you smoke and there's polyps on it. Okay, polyps are no fun either. Okay, polyps are these like little growths on your vocal folds, and again, you can't. Can you see the trachea? Can you see the rings, the cartilaginous rings? Notice there's no white. There's no like. You can't see. Here, you'll hear him talk here in a second. You guys are horrible people. All of you. We tried to introduce the kids to The Simpsons this weekend. They didn't quite get it. I think they're too young. But Marge's sisters were on there. You know, the smoker sisters. Like, yeah, Marge, how are you? You know, there's a reason why those 80-year-old women who've been smoking their entire lives sound like that, or sound like this. I know, it's horrible, right? So horrible. So terrible, right, Camry? All right. All right. So that's your vocal folds, and there they are inside your body. All right, let's take a look at where it goes from there. Okay, your vocal folds, of course, are inside your larynx. Okay, you can see another picture of this. Cartilage help form that, but it's all about the air and vibrating that air, and the pitch is all based on whether or not they're short or long, thanks to the cartilage, and whether or not you're loud or soft. Anybody that's in choir has been told that you need to project, right, at some point. Okay, if you've heard it once, you've heard it 5 million times. You can't be in choir and sing like this, right? You've got to get to your diaphragm, and you need to push it up because your diaphragm is forcing that air up. Okay, so where does it go next? The trachea. The trachea is made up of cartilaginous rings. Why rings? Because behind this is the posterior view. That's where your esophagus is. If you swallow something and it's too big, it actually goes a little bit into the trachea. Okay, we don't want that O-ring because that doesn't allow any give. Okay, anterior view, posterior view, there you see the hyoid bone and the epiglottis. Trachea goes down into the lungs that branch off into the bronchi. Okay, the bronchitis is an inflammation of the bronchi. And anytime you have an inflammation, that's going to impede the amount of air that's going to get to the lungs. So things like asthma too, you're tightening those airways, okay, and making it more difficult to breathe. Okay, the lungs, if you look at them, there's 2 of them. Let's see, I thought I had another picture here. Maybe I'll go to this one. No. Where's my other picture of my lungs? Did I lose it? Okay, there's 2 lungs. Here we go. Take a look at this one. Why is there a little notch here in the left lung? Yeah, the heart. Okay, so there's only 2 lobes in the left lung, 3 lobes in the right lung. But when we look at the inside of the lung, everybody thinks it's like a balloon. You blow up the sac, or if you puncture your lung, it's going to hiss. You know, that's not the way it is. Okay, if you remember when we cut into that lung, it's more spongy-like. And hopefully, Olivia Dale is going to bring in a fetal pig this week. We're going to cut the lungs out of that, and I'm going to hook the lungs up to the sink where Owen is. Okay, I'm going to put the trachea right on that nozzle, and I'm going to let the water drip through that lung for that hair for 24 hours. We're going to see what it looks like after that. Okay, the lungs look much different. You'll see. Lungs will look much different after you've removed the blood from them. Okay, they're filled with blood. Okay, and we want them to look nice and pink. Okay, unfortunately, sometimes they don't look nice and pink, but I want you to all know this term, and that term is alveoli. Alveoli is the end of the road in the lungs, but it's not just like one spot. They're all over the lungs. They're what gives the lungs that structure, but it's also the functional unit of the lung. So you breathe in, it goes down this trachea, it branches off into the lungs, okay, into these little bronchioles, right here into these tiny, I think they look like grapes, just like a, you know, a nice little thing of grapes. There you go. But notice the grapes are surrounded by red and blue. What is that red and blue? That red and blue is the oxygenated and deoxygenated arteries and veins. Okay, you can see that nice little red blood cell. We want oxygen going into it from the lungs, and we want to send carbon dioxide out of the lung, out of the blood into the lungs to be released in the body. Okay, all of that is based on those concentrations, high concentrations of oxygen, low concentrations of CO2, and vice versa. Okay, so the lungs pretty a lot more complicated than just this balloon-like sac filled with blood. The main point is to get that oxygen to the blood cells. How do we breathe? We all breathe thanks to our wonderful diaphragm that's really below this right here. You can see the heart, you can see the lungs. The lungs do have a sac around them. That helps with some friction. We call that the pleura. There's a parietal and visceral pleura as well. There's a nice transverse cut of the lung. And I'm going to jump ahead to this picture. You can see the diaphragm is relaxed here, and the diaphragm is contracted here. When the diaphragm contracts, we're opening up the lungs, therefore decreasing the pressure. So we have 760 millimeters of mercury of pressure in our air right now. Okay, if I have less pressure in my lungs, air is going to move in. When my diaphragm goes up like this, it creates more pressure in the lungs, so air moves out. We're talking about 2 millimeters of mercury both ways. Okay, 760 on the outside, 758, air goes in. Okay, if I switch the lungs in like this, it's 762, and air goes out. Okay, it's all based on pressure. The only reason you're breathing is to make sure, okay, that you're getting blood to the places in your body that need it, including your brain. If you don't get it to your brain, you may end up like this girl. Okay, I don't recommend this. This is not one of those things I'm showing you. You're like, oh, I really want to try this. Dear God, don't try this at home. Okay, but this is one of my faves from the television show Intervention. Let me know if you've seen it.
Allison is just a really bright girl.
She's studying to be pre-med. Allison's loving, she's fun, and she's a great person to be around.
I feel like I could conquer the world. No, it's okay. I need more of aerosol cans. We're gonna leave this instant and get it. Well, it wasn't right. I'm walking on sunshine. I wish I had a father. I tried it and I was done for. I lost my husband. I'm walking on sunshine. These places are so beautiful.
How much of that stuff do you have? Is that it?
Mama.
All right, there you go. Don't do that.
What exactly is it? Like,
It's the stuff you spray to clean computers. It's compressed air, but like you can like, yeah, it's like whippets. Like, you know, people like take the, I think for a while, like people were stealing it from Lance's, you know, like the whipped cream, the Ready Whip, right? To like, you like let the air out and then you like huff it and then it gives you this high, but it also kills you, right? You know, like, but, and like, here's the great thing. You do it once and like, fine, then you do it again, you're dead. Okay, because you're basically cutting off oxygen to your brain. That's why you get this like euphoria with it.
Huh.
Don't do it.
You shouldn't suck helium?
Yeah, well, helium's okay. You could suck some a little bit. You're fine.
yeah, because if you do too much, doesn't it like suffocate your lungs?
It could be bad. Yeah.
Yeah.
You do a little bit, but a little bit is not. I did see a TikTok where you could take compressed air and put it in a drain and blow out like your cloths, and somebody did it and went like all over their.
Oh.
Ooh, it was gross. Anybody see this TikTok? Yeah. If you laughed at all today during this lecture,
I know I'm going to help.